There are so many advanced treatments available for treating cancer. So, chemotherapy is not the only way of treating cancer. Now, you might have heard the term targeted therapy. So, let's talk about targeted therapy. What is this targeted therapy? Why is it called targeted therapy? And is it safe or is it just like chemo? So, let's know more about the targeted therapy. Hello, I am Dr. Poonam, founder at Innermbbs. Yes, your true inner hidden doctor, your mind, body, breath, and soul. Welcome. So, targeted therapy, my dear friends, unlike the chemotherapy, conventional chemotherapy is usually going in the blood and acting on all the fast multiplying cells in the body. We have seen in the previous video, right? But targeted therapy are medicines. Now, these are either tablets, pills, capsules, or some of them are injections. So, this targeted therapy is not going and acting on all the cells in the body. It is not it's not targeting all the cells in the body. It is actually targeting only a particular target. It goes and sits on the particular target for which it is mentioned. Now, for example, there are so many targets on the cancer cells, and it depends on what type of cancer it is. There are many targets which have been researched, and so many drugs have come out. The targeted therapy actually has revolutionized the response and treatments in oncology. So the outcomes in oncology have improved to a large extent with the use of targeted therapy. One of the very earliest targets and drugs which were identified was rituximab, imatinib. So imatinib is just a tablet, it's just a tablet which is used in one of the blood cancers called as chronic myeloid leukemia, or the CML. It's a simple tablet, and CML is not a disease to be very worried about. Only OPD follow-up is needed, and imatinib is a simple tablet where patient takes the tablet and comes to OPD every month, every 3 months with certain blood tests. So rituximab. Now, rituximab is another targeted therapy wherein it's an injection and it is used for a target called as CD20. Now, this CD20 is a target on the lymphoma cells, the B cell lymphoma. So when the lymphomas are B cell lymphomas or CD20 positive lymphomas, we use the CD20 directed targeted therapy. So this is monoclonal antibody. It's an antibody which is a targeted therapy which is targeting the CD20. Now, what happens? Now, this is used as an injection. Rituximab is available as an injection. So when we use this targeted therapy in B cell lymphomas along with the chemo, there is fantastic response for the lymphoma. So this is how combining targeted therapy with the conventional chemotherapy gives additional response. So here 2 plus 2 will not be 4. Here, when you combine targeted therapy and the chemotherapy, the 2 plus 2 may become even 10 or 20. So there is enhanced response when you combine both the modalities. Of course, there are guidelines, and we go through the same guidelines which are used worldwide, and what to combine with what, and whether only targeted therapy is enough or we have to combine with some chemo. That is all the guideline based decision. So in short, targeted therapies are much safer options. They have lesser side effects as compared to chemo, and the side effects are of different variety. Like sometimes hair side effects will be there. Hair loss is not much. Pimples, skin side effects are mostly seen. So pimples can be seen, some rashes can be seen, sometimes loose motion, sometimes little bit of uneasiness. But generally the incidence of side effects with targeted therapy is less. And other things are, we have to monitor the blood counts because it does affect the bone marrow, and the production of your red blood cell, white blood cell, as well as the platelets can reduce even with targeted therapy. So we do monitor them in the OPD follow-up with these blood tests. So some more targeted therapies, if you see, there are wonderful targets. Like one of the very good targets is VEGF receptor, so VEGF blocker. So these VEGF blockers are actually going and attacking the VEGF receptors. So now what is this VEGF? VEGF receptor is found on the blood vessels of the cancer. Now we know that cancer is multiplying fast. The cells of cancer are multiplying fast. When it is multiplying fast, in order to grow, in order for the cancer to grow, it also needs glucose and oxygen. It needs nutrition. Now from where does this nutrition come from? The nutrition will come from blood supply. So the blood supply of the cancer cells has this receptor called as VEGF, and when we use the VEGF blocker, the blood supply of the cancer is cut off. Now when you combine this drug with chemotherapy, what's happening? Again 2 plus 2 can become 20, because chemo will work on the cancer cells. Chemo will kill the cancer cells, whereas this VEGF blocker will kill the blood supply. So dual attack, and the cancer will shrink. Fantastic. So the response is increased when it is combined with chemotherapies. Now VEGF blockers are like your bevacizumab injection. It's available as a injection. It is used in many malignancies, right from brain tumor, then also in ovarian cancer, uterus cancer, as well as large intestine, colon cancer. So many indications are present, even in lung cancer. So VEGF blockers is also one of the types of targeted therapy. Some other types of targeted therapy are pills like EGFR blockers. What is EGFR? It is an epidermal growth factor receptor. It is a receptor on certain cancer cells which are specifically found in lung cancer. So lung cancer in stage 4 and even in stage 3, some cancers of lung, we do use these EGFR blockers which are revolutionize the treatment. So when we combine these tablets with the chemo, the response is again 2 plus 2 is 20. The fantastic response comes. And these are simple tablets like osimertinib, gefitinib, afatinib, erlotinib. So many tablets are available. So all treatments are not, only chemotherapy is not the option. Targeted therapy has come out in a very big way to help you deal with the cancer journey. So hope this video clears your myths about the targeted therapy. It's much safer, it's a better option, but you will have to talk to your oncologist whether the option is there for you or not, because not all cancers do have targeted therapy, but a lot of cancers are having this option. So you'll need to meet the oncologist, and the oncologist will help you guide in making the treatment decision. So I hope this video has helped you a lot. Please feel free to like, share and subscribe, and comment what was your biggest takeaway. If you have any doubt, please put it in the comment section and I will definitely come back to you. Thank you.